Flow is extremely easy to use for clinicians. It takes less than a couple of minutes to set a patient up on Flow. It saves the clinician time, it saves the patient's time, and it's very cost effective for the NHS. Flow is a very simple telehealth solution, and what it does, it makes use of patients' own mobile phone or their landline, and that's used as a way of communicating with clinicians. It's web-based, so that clinicians, wherever they've got access to the internet, they can access Flow and they can put the patients onto whichever protocol is most clinically appropriate for the patient. The protocols are developed by the nurses and the GPs and the other clinicians themselves, and they can adapt them then to be personal to individual patients. What Flow does, it allows the patient to take more responsibility for their own health, so it's all about patient self-management. The other thing it does, it allows patients to get on with their lives. So if they've got a long-term condition, they don't have to be waiting around for a nurse to visit, they don't need to have time off work or to visit their GP or hospital. Flow allows them to get on with their lives whilst managing their health at the same time. So for example, they can send readings into Flow as required by the clinician, or they can receive reminders, things like medication reminders, or just well-being messages. We've got patients who are using it for things like weight management and smoking cessation. So some of the benefits that patients have got from using Flow are around better use of their time. They understand their condition more, so they understand that if they send a reading in and it's outside their normal limits, they get to know that that's not a normal reading for them. And Flow sends information back and gives them advice in terms of what they should do next. So in terms of benefits to the NHS, particularly for patients' clinicians, what it means is that patients don't have to have as many visits or contact with their specialist nurse or their GP, because what happens is that in between visits, Flow interacts with the patient and provides information on their health that can be accessed by the clinician at any point in time. I think the other thing to say is that Flow is extremely cheap to use. The text messages are only 8p each. What we found when we first started using Flow with the heart failure nurse team in Nottinghamshire was that within 3 months of using Flow, they had halved the visits that they had to make to the patients on Flow. When you're thinking that a heart failure nurse visit is £67, the patient using Flow costs around £97 to use Flow for the year. There's a significant cost saving to the NHS. So the different ways that we're using Flow is around collecting readings from patients who've got high blood pressure, who've got chronic obstructive airways disease, heart failure, diabetes like Josh. Also we've got patients using it for to remind them to do things like simple things like remembering to take their medication at certain times. It's really useful tool to use with patients who've got other needs. We've got a patient who's got high blood pressure, but he's also blind, so he uses a talking blood pressure machine and a braille phone to send his readings into Flow. And this patient's found it fantastic because he's independent of his carers. Flow actually belongs to the NHS. It was developed by a guy called Phil O'Connell in NHS Stoke-on-Trent, and he then gave it back to the NHS so that it could be used for the benefit of patients throughout the country. Flow is a very simple telehealth solution, and what it does, it makes use of patients' own mobile phone or their landline, and that's used as a way of communicating with clinicians. It's web-based, so that clinicians, wherever they've got access to the internet, they can access Flow and they can put the patients onto whichever protocol is most clinically appropriate for the patient. The protocols are developed by the nurses and the GPs and the other clinicians themselves, and they can adapt them then to be personal to individual patients. Like for example with Josh uses a diabetes protocol. Most patients may only want readings from flow perhaps 3 times a day, but for Josh he needs 5 times a day, so it was very easy to adapt the protocol. At the moment we're using flow with over 700 patients throughout Nottinghamshire, and we hope that over the next few years that number is going to increase significantly. We are also moving into using flow in acute hospitals and mental health settings and in social care as well, and we hope that eventually flow will be used throughout the NHS for the benefit of both the NHS and for patients in terms of helping them to manage their health more proactively. Flow is extremely easy to use for clinicians. It takes less than a couple of minutes to set a patient up on flow. It saves the clinician time, it saves the patient's time, and it's very cost effective for the NHS.